Assalamualaikum, my name is HAZIQAH binti FAZLI. In this video, we will be present about familial hypercholesteremia, which is also known as FH. I will start with the introduction of this disease. Okay, what is actually familial hypercholesteremia? It is a genetic disease that causes very high level of LDL cholesterol, which is also known as bad cholesterol. Because LDL cholesterol level build up in a blood vessel over time, people with FH have much higher risk of early heart disease, especially if the condition is not treated earlier. For disease prevalent, familial hypercholesteremia is considered one of the most common inherited metabolic disorder in worldwide. Globally, about 1 in 200 to 500 people have the more common form, which is heterozygous familial hypercholesteremia. However, the rare and more severe form called homozygous familial hypercholesteremia occur in approximately 1 in 160,000 to 1 in 1 million people. This form lead to extremely high cholesterol level and early cardiovascular complication. Next, how this disease is inherited. Familial hypercholesteremia is usually inherited in autosomal dominant pattern, which means a person only need one affected gene from either parents to develop this condition. In heterozygous FH, one gene is affected, so cholesterol level are high but can manageable with treatment. For homozygous FH, both genes are affected, making the condition much more severe. There are also have rare cases, which is this disease is inherited in autosomal recessive pattern, where both parents carry the gene mutation but do not show symptoms themselves.
Moving on to the next part, which is genetic mechanism of familial hypercholesteremia. We need to understand which part is affected that leads to this disease and how it affects the human body regulation. The main gene that is involved in this disease is LDLR, or low density lipoprotein receptor. LDLR gene are functioned to bind with low density lipoprotein particles in the liver, thus helping in regulating blood cholesterol level. The main problem for this disease is when mutation happen at the LDLR gene that lower the ability to take up low-density lipoprotein in the blood. In continuation to that, this leads to accumulation of LDL, or known as bad cholesterol, in the blood circulation that will result in atherosclerosis. However, there are also less commonly mutated genes that will cause familial hypercholesteremia, which are alpha-lipoprotein B, LDLR adaptoprotein 1, and also proprotein convertase subtosylin casein type 9.
The next part, I will explain how this disease can be diagnosed. Diagnosis of familial hypercholesteremia is important because early detection can help prevent serious heart complication. Okay, first, familial hypercholesteremia can be identified through clinical screening using standardized scoring tools. For example, we have Dutch Lipid Clinic Network (DLCN) criteria and the Simon-Broom criteria. These two assess factors such as cholesterol level, family history of early heart disease, and physical findings to estimate the familial hypercholesteremia. The second one is lipid profile test. This test used to measure LDL cholesterol level, adult LDL cholesterol level of which is 119 mg/dl or higher are suggestive to familial hypercholesterolemia. For child, LDL level is 160 mg/dl or higher risk suspicion. This unusual high level, especially from a young age, strongly indicate a genetic cause rather than lifestyle factor alone. The last one is a genetic testing. It is used to confirm the diagnosis by identifying the mutation in gene. For example, we have LDLR, APOB, and PCSK9. However, genetic testing is not usually applicable or available in Malaysia. So the diagnosis often rely more on clinical assessment and lipid profile result. Conclusion: familial hypercholesterolemia can be diagnosed through clinical screening, lipid profile test, and genetic confirmation when available. It's allowing early treatment and prevent heart disease.
Of familial hypercholesteromia, fasting or angina, heart attack at a younger age because of accumulation of cholesterol, LDL, low density lipoprotein in the blood vessel. This will form blood that later will obstruct the blood vessel and cause heart attack, and the next symptom, which is the stroke. Next is calf cramping because of narrow blood vessel due to accumulation of cholesterol. This will lead to reduced blood flow and cause cramping, pain in the calf. Next is tendinitis, accumulation of cholesterol within the tendon fiber cause inflammation. This occurs without a clear injury. Next is xanthomas, which is a yellow plaque because of cholesterol deposit under the tissue of the skin. This usually occurs at the skin of the elbow, Achilles tendon or heel joint, finger or eyelid. Next is xanthelasma. Cholesterol deposit under the skin of the eye occur at upper eyelid or lower eyelid. Lastly will be the whitish grey ring or bluish color around the iris. This is because of cholesterol deposition along the iris. This is a normal part of aging if you are 50 to 60 years. But if you are younger than that, this can indicate health condition like familial hypercholesteremia.
Now, for the last part, I will explain about the management and intervention. Familial hypercholesterolemia must be treated early to prevent cardiovascular complications, such as atherosclerosis. But how do they treat it? And what is the current treatment method that used nowadays? The treatment for this disorder focuses on reducing the extremely high level of LDL cholesterol, or also known as bad cholesterol. Medication that is commonly used to treat this disorder is ezetimibe. This medication can reduce LDL cholesterol level by at least 50%. However, for some severe cases, for someone who has extremely high LDL cholesterol level, LDL apheresis is recommended. It is a dialysis-like procedure that is done every week to remove cholesterol from the blood. Other than that, injectable medication, or also known as PCSK9 inhibitor, also can lower cholesterol level. This medication target and block the PCSK9 protein, which frees up more receptor on liver cell to remove LDL cholesterol from the blood. And for future treatment, gene therapy strategy offers a promising future approach for the treatment of this disorder. There are two main gene therapy methods. The first one is RNA targeting agents. RNA targeting agents do not change the DNA. Instead, they work by switching off harmful genes, which reduce the production of proteins that increase LDL cholesterol. Their effect is long-lasting but not permanent. So, repeated treatment is needed. For example, is siRNA therapy, such as drugs that reduce PCSK9 levels. The second one is DNA editing agents. This method directly change the DNA itself. They work by correcting a faulty agent or permanently disable a harmful gene. It is a long-lasting treatment that requires only a one-time treatment. These therapies have the potential to address the root genetic cause of familial hypercholesterolemia, but they are still in the early stages of research and development.